what we are observing is that the curve, the peak of the fourth wave, in the last 2 weeks, we have had a steady decline in the number of cases. And so it's suggestive of what we may call a decline or a descent of the fourth wave. The fourth wave is largely fueled by the Omicron variant of COVID-19. And so this is what we are witnessing, and we think it's an encouraging trend. The data we are gathering is suggestive of the fact that while the Omicron variant of the COVID-19 may be very highly transmissible, clinically we have seen relatively less severe manifestations, and that has accounted for the comparatively lower deaths or fatalities that we have seen in the fourth wave.
Where are we seeing the reduction? Is it country-specific or region-specific?
The observations are across the region. There is the aspect of low fatalities or less severe impacts observed from Omicron-related cases. But then, of course, there are a number of other factors. We cannot discountenance the fact that the vaccination of the vulnerable population, within which we expect the severe outcomes like deaths, we've made progress in that area. We've also made progress in the investment that we have made in terms of strengthening case management capacities. We understand this disease better, and we are better able to care for them. We have also done some work in terms of pre-positioning the necessary resources that we require to care for patients with COVID-19. And I think all of these factors contribute to the trend that we are seeing, not just in one country, but spread across the region.
So how do we maintain this trend?
While it is a bit difficult to predict with a large precision the direction in terms of what we will see in future, WHO is exploring what we call a repositioning of our strategy. We will be launching what we call the CARE strategy. CARE is an acronym, C-A-R-E, and CARE actually stands for Confirm, Assess, Respond, and Evaluate. So we are focusing on a strategy that identifies and confirms cases of COVID-19, have a thorough clinical assessment of those cases in terms of the clinical manifestations, the vulnerabilities. Of course, you know that patients with comorbidities are most vulnerable and are most at risk of severe manifestation of disease. We are also looking at responding. Following this assessment, you want to provide the appropriate treatment, identify the patient, so you want to give the right patient the right medication, the right time, and in the right dose. It is then important for us to focus on the public health measures that we have put in place, focus on cascading this key information to the countries at subnational levels, at community levels, while also strengthening our capacity to manage cases.
Dr. Ejiofor, right now the Africa Cup of Nations is ongoing in Cameroon. What would the WHO say in terms of keeping people safe?
Preparatory to this tournament, there were consultations, there were deployments of experts who had to make an assessment of the measures that have been put in place to ensure that this does not turn out to be a super spreader event. And so long as those recommendations are being fully complied with, I think that the chances that there will be a surge following the tournament is quite low. There is demand for the correct information. There is more than ever before. Africans want to know, what do I need to keep safe? What do I do that puts me at risk? So I think that we can leverage the opportunity that the African Cup of Nations provides to also drive these messages.
What are your thoughts in terms of lessons learned and moving forward?
We do not have control over the behavior of the viruses, but we have control over our behavior. We have control over how we can approach it, over how we can shape our living in a way that does not pose a health threat to either ourselves or those around us. And so I think that the message I'd like to leave here will be for us to continue to take those measures that are recommended by governments of member states, by public health experts, cuts across board, take them seriously. The fact that Omicron has not manifested severity in terms of clinical outcomes is not a guarantee that if there is another variant, and there is likely to be, that it will be the same as Omicron. And so for me, to Africans, it will be that it's not over yet. We've made some tremendous progress, but I know that a lot of work still needs to be done.